We want to celebrate the CHITIN programme. The 11 studies have been delivered through the hard work and diligence of the research teams, and we want to commend them all on how determined and persistent they have been. All of the trials tackled important health questions in different topic areas such as diabetes, obesity, stroke, mental health, to name but a few. Research is a collaborative activity, so it's enhanced where partnerships are built. And the long-standing partnership in particular between HSE R&D Division and HRB has been productive over the years, and we intend to continue working together into the future.
We saw diverse applications in all sorts of areas. It was really, really exciting. I think probably one of the things that excites me most about CHITIN is it was purposely designed as a network of CHITIN projects. Sometimes those conducting trials and studies can feel quite isolated and it's quite daunting. But the community was built and came together throughout to cooperate, to share learning, both between the academic system, the healthcare system, across border, across disciplines, across funders, and we've all learnt from one another.
The aim of the REFLEX study was to investigate the effectiveness of the mirror box in upper limb rehabilitation in a subacute setting.
Whenever a stroke patient comes to us, sometimes they do have an upper limb deficit. The idea of the mirror box is it regenerates neural pathways in the brain to hopefully encourage the affected limb to work again.
We started off as clinicians here in White Abbey. We had a discussion in this room, round this table at coffee time, saying, you know, is this something we could do? Could we be involved in research? And I think it probably was the enthusiasm of the team that said, yes, let's give it a go. The patients have been very keen to be involved in the study. Many of our patients have said to us they wanted to be involved because if it doesn't benefit them, it may benefit patients in the future.
The aim of the HIPPY study, so the Healthy Habits in Pregnancy and Beyond study, was to really support women who enter pregnancy at a higher weight with a series of different kind of healthy eating and physical activity behaviours to really support them during that pregnancy time period and to try and avoid something called excessive gestational weight gain. Recruitment for the HIPPY study was a little bit challenging because unfortunately right around the time that we wanted to recruit women into the study from antenatal care, we had the COVID-19 pandemic. So that made recruitment quite tricky, and we had a number of different partner sites involved in the study, but we did manage to do really what we'd hoped. The headline findings from the HIPPY study have been really positive so far. Women have overall rated the study as really acceptable in terms of the way that it was introduced to them and the way the healthcare professionals talked to them about it. They felt that it was a good time to introduce it in pregnancy, early in pregnancy, and also they felt that overall it really did help them to sort of enact these series of different healthy behaviours throughout the course of their pregnancy. So we're really pleased with how the study has gone at this feasibility stage.
We looked at the area of multimorbidity, which is really, really important. Multimorbidity is extremely common and has huge impact on patients' lives. In fact, it's so common that probably a quarter of all people have multimorbidity. And by multimorbidity, we mean experiencing two or more conditions at the same time.
An intrinsic part of my Comrade study was involvement of what we call a PPI group. We had a group of 4 people. All 4 have history of having multimorbidity and polypharmacy. They worked as a team exceptionally well, invaluable in informing our study in relation to the design of the tool that we used to interview patients. And with their input, we developed what we call a framework, a template framework to reflect all of the data of all the remaining interviews.
Obviously, this study would not have been possible without funding, and we're very grateful to CHITIN, who coordinated all the funding for us, and quite a complex system, obviously, between north and south of the border.
The aim of our study was to test the efficacy of an online cognitive behavioural therapy-based intervention in reducing the symptoms of mild to moderate anxiety and depression in students. The acronym is SPIT, and the reason for that is that as part of our study, at the same time that we collected survey data on mental health in students, we also asked them to provide us a saliva sample, which we're using to assess whether we can identify any novel biological markers that are associated with mental health issues like depression and anxiety. We found that students who were enrolled in the intervention saw an improvement in depression and anxiety. One significant finding from our study was in students who are living with ADHD specifically, and this has led to both a paper that we've published and also has allowed us to secure some additional funding to do a bit more research on this area. We've recently won the Irish Education Award for Best Research Project in 2023. This is a great recognition for the Student Psychological Intervention Trial.
The study is called the WISH study, which stands for Walking in Schools. The aim of the study is really to try and increase physical activity in adolescent girls, because we know that this is a group that in particular may have lower levels of physical activity. So we wanted to provide them with opportunities to do physical activity during the school day. We've really used PPI a lot to inform the design, the implementation, and how we disseminate the results of this study. Across the WISH intervention, we conducted some youth advisory groups. At the beginning, this was to inform in relation to the design, and we picked up a lot from those girls that participated. Also gave us a lot of ideas in relation to recruitment and how to make the participation in the study that little bit more attractive. CHITIN was a perfect opportunity for us to receive some funding that would allow us to undertake a fully powered, clustered, randomised control trial of our intervention.
Across the CHITIN programme, a number of the health intervention trials have excelled in their public and patient involvement. They've faced the most challenging times there have been for healthcare and research that any of us can remember. And it's up to us all now to take the evidence generated from the HITs and bring forward better health and social care into the future.
And we've all learnt from one another. We've enriched one another's work. And I think that's something which there's a legacy beyond these CHITIN projects. And I think that's something that's really exciting and that we need to make sure that we harness and that we build on into the future.